By now, it's likely that you've seen some reference to Healthy UNH. Maybe you saw a poster hanging in your department or a water bottle at the gym. Healthy UNH is a new initiative working to make UNH the healthiest campus community in the country by 2020. That's a big challenge for us all, but we can do it. By improving our health and decreasing healthcare costs, we can become the healthiest campus community in the country by 2020. So we start by asking you, what is health?
Health is living a balanced life in many different facets.
It means being able to resist diseases and be able to do the kinds of things you want to do when you want to do them.
Having a healthy environment to work in, psychologically, emotionally, spiritually.
It means wellness, it means the way you think, the way you eat, the way you move your body, you're fit.
You take care of yourself, you're going to prolong your life, you're going to better the quality of your life, and it betters not just yourself but the people around you, your community, your co-workers.
It means being able to get out, spring out of bed every morning and embrace the day.
Being healthy is a lifestyle choice. It's about what we do and how we think.
Health means to me drink lots of water, eat good food like an apple.
Health is a connection between body, mind, and spirit, where it's all in alignment and you can do whatever you want to do.
Health to me means just being active and being able to do the things I'd like to do in my everyday life.
It's clear that health can mean different things to different people. At Healthy UNH, we look to the Institute on Medicine to define health. Health is a state of well-being and the capacity to function in the face of changing circumstances. It's a positive concept, emphasizing social and personal resources as well as physical capabilities. In real-life terms, we interpret this to mean that health is overall wellness in mind and body that allows us to stay strong and productive as life comes our way. Healthy UNH has chosen to focus on the rising rates of chronic disease, increasing rates of stress, anxiety, and other mental health issues, and providing better information and resources to promote health. In the last century, life expectancy increased by 30 years. Only 5 were from enhanced medical procedures. 25 were the result of public health efforts, which is what we're talking about today.
I charged a group of faculty, staff, students, and administrators to think about how to make UNH healthier. In fact, my goal, I think it's now a shared goal, is to try to make UNH the healthiest campus community in America by 2020. And it's an initiative that we call Healthy UNH. And not only will it make us healthier, it will also produce a savings for USNH and for UNH.
I think what people can do to be healthy at UNH is to show up to all different events that we have to begin to understand more about their health and begin to improve their health and well-being. USNH has been offering wellness programs for over 25 years in an effort to improve the health of its employees. Current programs and assessments indicate that the top 3 health conditions of our employee population are being overweight, having high blood pressure, and escalating stress levels. While we are a relatively healthy group, we can still improve, and improving our health will decrease our health care spending.
At UNH, we have about 3,000 employees and another 3,300 dependents that we provide medical care for. That costs about $50 million, or about $8,000 for every person who's covered. Thinking about it another way, that's $16,000 per employee. In addition, those costs have been going up at about 10% a year for the last 10 years. We obviously can't increase our tuition and our prices for research at that level year in and year out. So as a consequence, many other elements of our expenses have to be trimmed to balance that medical care budget. But there is another option. We can find a way to live within a balanced budget in the medical care account and have more predictable, normal cost of living increases there. But that means we're going to have to negotiate lower prices with many of our medical care providers. We're going to have to take actions to stimulate price competition, and we're going to need to engage our faculty and staff and their families and reach out to them and educate them to be active partners with their medical care providers in managing utilization. In particular, finding evidence-based approaches to use the most expensive parts of our medical care system less often.
One way to help manage our healthcare budget is to learn about cost variation. Did you know that the price of a medical service or procedure varies by provider? This is called cost variation. There's no correlation between price and quality of services received, yet prices can vary by about 70% across the state. A medical provider will perform the same exact services, but determines a pricing structure based upon what insurance companies agree to pay. We can affect healthcare spending by choosing to receive care at facilities that charge less. The UNH Health Cost website provides information on the prices of medical care in New Hampshire. It makes health cost information easier to find and understand. It can help us bargain shop for healthcare like we do for plane tickets or a new car. Let me show you how it works by clicking Get Started. Hypothetically, say I injured my knee and my physician told me I needed an MRI. I click on Radiology and then MRI knee. Then to make sure price points are accurate, I select the type of insurance I have, which is Faculty and Staff HMO. Here are the detailed cost estimates for having an MRI in New Hampshire. This chart is an example of cost variation. These numbers are accurate today, but since they're updated quarterly, may be different when you look at them. So check here before deciding where to go. I can expect my insurance company to pay as little as $900 for my knee MRI, or more than $2,800 for the exact same test. The only difference is the location in which the test is performed.
The reason to care about cost variation is that if we pay 50% more for an x-ray at one institution compared to another, and it's the same quality of film and interpretation, we're essentially taking more out of our budget than we need to.
It may cost you only $10 immediately, or it may cost me $10 immediately as an out-of-pocket copay, but the fact is that it's the total cost that we have to be concerned with. Somebody's got to pay that, the rest of that insurance bill. And while it may not be you or me immediately, we may think immediately only about the $10 copay. The fact is that sooner or later it comes back to you and me. It comes back certainly to USNH. They've got to pay the rest of that bill. And ultimately that comes back to you and me, because that's every dollar they spend in paying the rest of that insurance bill is a dollar less they have to contribute to other things, including our base pay. So we all really have an interest in trying to keep health care costs down.
Do you have a primary care physician who coordinates your medical care? If you do, this might be your medical home. A medical home is an approach to providing comprehensive care that recenters health care on a patient's needs and priorities. Medical homes have been shown to improve health outcomes, reduce costs, and improve patient, family, and physician satisfaction. Another way we can save money is by using emergency rooms and urgent care facilities more appropriately. What does this mean? Your first choice would be your primary care physician. Many physician offices have same-day appointments and are open in evenings and on weekends. If that is not an option, go to the nearest walk-in care facility. Plan ahead and know where to go before you need it. If you're experiencing a real emergency, then you should go to the emergency room. Office-based appointments are at least $250 less expensive per visit than urgent care or emergency room care. Although the amount you pay out of pocket is low, the overall cost is passed on to the university system, resulting in higher benefit costs overall. If emergency rooms were used appropriately, USNH could save over $200,000 per year. When you fill a prescription at a pharmacy, it is for either a brand name drug or a generic drug. A brand name drug has a trade name and is protected by a patent. Every drug you've seen advertised in magazines and television commercials is a brand name drug. It cannot be produced by anyone other than the patent holder. When a patent expires, these drugs can be produced by other companies with FDA approval. Generic drugs contain the exact same active ingredients as their brand name counterparts, but allow for competition in the marketplace and can be much less expensive. By increasing our use of generic drugs by just 10%, we can save $250,000 per year. Another way to cut our prescription drug costs is by using the mail order prescription service. BioScript, the company that manages the Harvard Pilgrim Prescription Mail Service program, accepts orders in 3 easy ways: online, by mail, or on the phone. Simply place your order and wait for a 90-day supply of medications to be delivered to your door. And if you live in New Hampshire, your copay for these meds is less expensive than if you pick them up at a pharmacy. Have you ever arrived at a doctor's appointment to learn that your x-ray films haven't? Instead of wasting a visit, your physician orders another set of x-rays. This is an example of duplicate testing. Nationally, 1 in 5 radiology tests is a duplicate. If UNH eliminated duplicate tests, an annual savings of $460,000 would be achieved. Next time you have an appointment for imaging results, call ahead to make sure the films have arrived in the doctor's office. If they have not, reschedule the appointment. Save yourself a trip and save the university a few bucks. So what is Healthy UNH doing? First, we formed an advisory group to determine the best way to collect health data about our population to show us where we stand. This is an important step because it will allow us to track our progress as we get healthier. Next, we are exploring the possibility of bringing on-site primary care to UNH employees. Imagine being able to walk to your lunchtime doctor's appointment. Not only will this be more convenient, but studies show that companies that invest in on-site primary care are able to control the growth in healthcare spending much easier than those who do not. And you won't have to give up your parking space. In addition to on-site primary care, we are also working with local hospital systems to contract lower rates for UNH employees. Have you attended any Healthy UNH events? We launched this initiative in October of 2009 with a campus-wide walk and wellness fair. We have partnered with lots of campus departments, including health services, dining services, campus recreation, the Discovery Program, and the Office of Sustainability, among others. These events are focused around healthy eating and getting active to promote overall well-being. Look for upcoming events on our website, as well as the UNH calendar. We are working to integrate a health and wellness component to orientations for new employees and students. This will really show newcomers that UNH is committed to improving the health of its population. And finally, we've adopted recommendations from health professionals to advise people on how to get active and eat well.
So what can you do to contribute to Healthy UNH? First, you have to know what your numbers are. Take an inventory of your health and get a checkup. Discuss all of your important numbers with your physician: weight, body mass index, cholesterol, glucose level, and blood pressure. One way to know your numbers is by attending Healthy Returns, a biometric screening program offered twice yearly by Harvard Pilgrim Healthcare and the University System of New Hampshire. The study that Harvard Pilgrim did with the Healthy Returns program is to begin to look at those individuals who attended Healthy Returns 4 different times. So that means they attended over 2 years. What we found is that their numbers were reduced radically. People who had hypertension, high blood pressure, now had normal blood pressure. They were off the medication. People who had high glucose levels were now normal. People who were a little bit overweight were now beginning to maintain their weight. That's really important because what that means is that if you're healthy, you go to your physician less often. You don't have to be in the emergency room. You don't have to be hospitalized. And the cost of care, therefore, goes down, as well as you get to be a healthy, productive, happy person.
Next, get active. The CDC recommends that most adults need 75 to 150 minutes of cardiovascular exercise per week, in addition to strength training twice weekly. Campus Recreation has lots of resources to help us get moving. The Hamel Recreation Center features 7,500 square feet of exercise equipment, athletic courts, and fitness classes. They have campus maps featuring walking and running routes, maintain the campus pools and athletic fields, and even provide equipment rentals to the UNH community. The best part? Harvard Pilgrim subscribers are eligible to receive up to $500 per year in fitness club benefits. You can join a gym for free. Get active your way. Another place to get active is at the Field House, home of the Kinesiology Department's Employee Fitness Center, where both undergraduate and graduate kinesiology students can get real-world experience offering fitness training to faculty and staff. Nutrition professionals recommend that we strive to eat 9 servings of fruits and vegetables daily, reach for low-fat dairy and lean cuts of meat, switch to whole grains, and choose healthy fats. UNH is one of the first schools in the nation to partner with Guiding Stars to enhance nutritional labeling and encourage healthier eating. The Guiding Stars nutrition rating system in dining halls and retail locations can help us all make healthier food selections. One way to learn more about eating a healthy diet is through the Center for Health Enhancement. It offers a 10-week weight management program, which is designed to teach participants practical strategies for diet and weight management. Another source for learning to eat better is attending Weight Watchers meetings on campus. Harvard Pilgrim subscribers can get reimbursed up to $200 per year for attending these health education classes.
So today I'm going to show you how to use the Stress Eraser tool.
Let's talk about addressing your stress. Over half of people that go to the doctor's office for visits are for stress-related symptoms, such as headaches, insomnia, anxiety. And while our Employee Assistance Program is excellent here at USNH, and it points us and gives us many resources to help us in our hectic lives, we now have a program that utilizes a tool called the Stress Eraser, which is a biofeedback device that helps us practice a breathing technique so we can elicit the relaxation response and be focused, attentive in our work, but again, relaxed, and it lowers our stress rate.
Understand that health cost is complicated. Choices we make do affect what UNH pays.
Part of our strategic plan is to try to create an organizational culture where we can imagine ways to design our work lives that maximize opportunities for managers and members of the staff to be able to pursue fitness regimes or nutritional needs on a flexible basis in a way that will help both the employee and the organization. So flexibility really is key to the success of this project. This will be a team effort. Everyone's going to have to pitch in and work together to make this happen.
And finally, get involved. Join us at campus fitness events, follow the guiding stars in the dining halls, and order from the Healthy UNH catering options. Information on all of these things can be found on the Healthy UNH website. So what do you do to make a healthy UNH?
I like to come to the rec center here and do yoga a couple times a week.
I either use the elliptical or I go outside and run every day.
I enjoy kayaking.
I walk every day at my lunch hour.
I go to the gym about 4 or 5 times a week, and I work out in the Nautilus machines.
Oh, I run during my lunch breaks 2 or 3 times a week.
I like to use kettlebells. I go to my local kettlebell studio and try to go at least 3 to 4 times a week.
We like to hike.
I ride my bike to work about 3 times a week.